Good afternoon, guys. If I'm visible and audible, please give me a thumbs up so that we can start with the session. Right. So we'll start with the recall of the anesthesia questions. If there are any doubts or corrections in the STEM, guys, please let me know. Anyways, this is all from what the students have recalled. So we'll be discussing about the session 2 now. Right. So I'll have my messages in front of me, and as you guys say, then we'll just discuss those things out. Fine. So starting with the anesthesia part, guys. The session 2, yesterday we had discussed the session 1. Today what we are going to do is to discuss the session 2, right? We are discussing about the session 2 questions which were there. Just as in session 1, we found almost 7 questions that came from anesthesia, 6 to 7 I will say, because some can overlap with pharmac also. And similarly, this time in session 2 also, the last evening, the session which was held, there were about 6 questions from anesthesia. Okay. Now, the first question, very simple. This was an easy thing. This was a previous year question which was previously repeated also. This is a PYQ, right? Last year's NEET PG. So during resuscitation, an unresponsive patient is there. I mean, the stem of the question might be different, the points will be different, but that is how the students have recalled it. So during resuscitation, there's an unresponsive patient kept in the following recovery position, as in the image, which indicates which of the following: pulse and breathing both are present, pulse and breathing both are absent, pulse present and breathing absent, pulse absent and breathing present. So when you keep a patient in the recovery position, the point is that pulse and breathing both are present. In case pulse and breathing, both of them have been absent, you will start giving CPR to the patient. Okay. Right. So unconscious patient and breathing present. Correct. That's what the point is, right? So this is unresponsive, unconscious patient, and the breathing is present. So unresponsive patient, but pulse and breathing both are present. Now, if another situation would be there where pulse is present and breathing is absent, in this case, what was absent is breathing. So here you're supposed to give only breath to the patient. Am I right? And in the second part, when you see, I mean, the last part, when the pulse is absent and breathing is present, which means respiratory rate is there and pulse is not felt. And if the patient is unresponsive, this is a common scenario which people have seen in the wards, right? Hypotension in a patient. So hypotension can be because of anything. Respiratory rate is already present. So you're going to take care of the circulation, which means you're supposed to give IV fluids to the patient. You will give dopamine to the patient, dobutamine, adrenaline, whatever it is, you will manage according to the physiology or etiology of the case, right? So Dr. SJ says these two options were there: conscious, pulse, breathing present. Correct. Conscious pulse नहीं होगा ना, patient conscious रहेगा तब तो ठीक है. If the patient is conscious, why will the patient be responsive, right, Dr. SJ? One was conscious and other was unconscious, says Dr. SJ. Right, but the whole point is that the patient. Okay, so Dr. SJ is saying patient was conscious and the other was unconscious. So you help me correct the stem now. Then in that case, he says unconscious and conscious, right? So unresponsive patient is there. And if the patient is kept in the image like this, it means the patient is going to be unconscious. Na? If the patient was conscious, why will you keep him in a position like this? So that point is out. So the point is ultimately pulse and breathing are present, but the patient is unconscious. Right. So I get your point. So this makes it the correct statement. Am I right, Dr. SJ? Right, Dr. SJ? So this is the correct answer, that pulse and breathing both are present, but patient is unconscious. Had the patient been conscious, which means patient is fine, na? Why will you keep the patient in recovery position at that point of time? You keep a patient in the recovery position so that in case there is a vomiting that takes place, the patient does not aspirate. In case he throws a seizure, he does not bite the tongue. So there are 2-3 reasons why you want to keep a patient like this. A patient who is unconscious but pulse and breathing is present. In this case, I don't want the patient to aspirate during vomiting. And in case he throws a seizure, I don't want to have the tongue bite or injuring himself in the airway, right? So Dr. Pallavi says correct, Dr. Nimra says correct, Dr. SJ says correct. Thank you, guys. So that is the correct point. So this was the option asked in the exam: pulse and breathing present and the patient being unconscious. This was the answer to this question. Correct? Good. So that's why recall becomes important, guys. Even I come to know from all this, right? Thank you. Let's go to the next question. If there are any doubts, you can ask me, and wherever there are corrections, please help me out, guys. The recall from what students have said, it's based on that, right? So let's go to the next one and without wasting any more time. Okay, so this was an easy question. Identify the image. I think everyone has studied it. The only point was unless and until you're not sure what has happened, right? So here you can see a double tourniquet kept over here. There's the IV cannula which is seen. So this is nothing but the Byers block, or what is called as the intravenous regional anesthesia. Guys, this question has been asked like this after a very long time. Okay, right? Byers block. And all of, I think everyone, everyone has studied this question. All of us expect that, sometimes this will be asked. For last 3-4 years, they were not asking this question. But yeah, this time anesthesia questions, I'll find them 1 or 2 questions were off the track. But, normally it is, if you have studied anesthesia well, you could have answered the questions, except 1 or 2, that I agree, 2 questions, which I'm going to discuss, not very easy and not very easy to remember. So here it is easy. This is not a wrist block, not a median nerve block, not a radial nerve block. It's a Byers block. Intravenous regional anesthesia, where use only 2 drugs, either prilocaine or prilocaine can be used, or lignocaine can be used, and bupivacaine is contraindicated, right? There are double tourniquet is what makes you identify. So you inject the drug IV, and then you giving regional anesthesia from the IV drug that you've injected, right? So everyone agrees with me. It's a Byers block. Dr. Sanke, Dr. Nimra, Dr. SJ, everyone. Let's go to the next question without wasting time. So now this was a question where I think, I don't know exactly whether this strabismus surgery was mentioned or not, but a patient was undergoing general anesthesia, and during the surgery, it was mentioned as a clinical question that during the procedure, the patient developed a rise in temperature, a rise in CO2 levels, and there was muscle rigidity seen. And which of the following drugs is most likely implicated in this condition? So there's a surgery going on, and during the procedure, there is an increase in temperature, right? There's an increase in carbon dioxide, and you are getting muscles becoming rigid during the surgery, which means muscles are getting involved. So Dr. Nimra says, yes, malignant hyperthermia was there. So that's the question. So you are discussing malignant hyperthermia over here, right? And the correct answer to this question is halothane from the options given. So normally you will find what are the drugs causing malignant hyperthermia are only 2 drugs basically from anesthesia, all the volatile anesthetic agents. And out of that also, halothane causes the maximum malignant hyperthermia, and apart from that you get succinylcholine, right? So these are the 2 drugs or agents which cause malignant hyperthermia, which is a genetic disorder, right? It's a genetic disorder of sarcoplasmic reticulum, ryanodine receptor gene abnormality. So when the patient gets exposed to these drugs in the OT, suddenly during the surgery, so you get all the symptoms under anesthesia. Before that, the patient will be normal and running and fine. It's under anesthesia that all the symptoms which you have seen, which has been given in the exam, that there is increase in temperature, increase in carbon dioxide, and muscles getting involved, because it's a genetic disorder of the sarcoplasmic reticulum which is present in all the muscles, right? So therefore, this is the malignant hyperthermia is what we are dealing with, and out of the options given to us, the correct answer is halothane. This is most common implicated for malignant hyperthermia, right, guys? Dr. Nimra says ryanodine receptor chromosome 19. Good, perfect. Perfect. Dr. SJ says succinylcholine. Dr. Dipti Sahu says orthopedic surgery. Fine. So it was not a strabismus surgery. Correct. So Dr. Dipti says this was an orthopedic surgery, and this is how we reconstruct the questions. So Dr. Dipti says orthopedic surgery was given. So let's put it this way. Patient was undergoing orthopedic surgery under GA, and during the procedure, he develops all the symptoms of malignant hyperthermia, and the correct answer to this question is going to be halothane, which has caused it. Correct. So we are done with this question as well. Let's go to the next one. Again, a simple question. And whenever I'm teaching, whenever I'm going for teaching, whenever I show this image, I'm not saying right now, for the last 12 years that I've been teaching, whenever I go and show this image, everyone tells me this is called the rose position, and not in one part of India. I'm saying right from the north to the south and from east to the west. Everyone calls this the first time rose position because all of you have studied ENT so well. Everyone says that, and that is why this question was problematic for some people, where they thought that it is not necessary for intubation, right? I'm not very sure about all the options present over here, but 2 options which everyone has told me is that intubation was given, bougie was given. These 2 is confirmed, right? So Dr. Nimra says sniffing. Yes, this is the sniffing position for intubation. Sniffing the morning air. You open the windows in the morning and sniff the morning air, sort of. Endotracheal intubation option was given and not sniffing. Okay, fine. So Dr. Pallavi says sniffing position was not mentioned, but intubation was given. So let us put the question in this manner. What is the position of the adjoining image used for? And now you get the four options: intubation, neurosurgery maybe, neck position for ENT surgery, or maybe just cancel this also out. It must be ENT surgery than what was asked in the exam, and for insertion of bougie. Am I right? Neck position for intubation says. In the image, the three axes were mentioned. Okay, fine. So here I got another image here. I made it very fast. I ran from the hospital and I made the PPT. So, I did not get the same image, but you're right. Normally there are three axes which come in one line. Absolutely correct. So you get the three axes. Very nice put forward by Dr. Dr. Naveen says sniffing was given. See, you people are, अब decide कर लो. Guys, decide sniffing was given or not given. So some people have said sniffing was given. Some people are saying sniffing is not given. Anyways, decide it. Let's take whether it's given or not given. The point is, let's take these four options: intubation, neurosurgery, ENT, and bougie. And I know in the exam, perhaps another two lines were given like this. So the three lines which were given are the oral axis, the laryngeal axis, and the pharyngeal axis. The whole point of making the sniffing position during intubation, this is the practical point. As I said, when we were discussing with amongst all the faculties, that we all said that this question paper normally has come from AIMS. The way they have asked the questions, the way they have, the way things have been asked, it's normally like an INI-CET paper. It is not like a NEET PG many a times. It's like INI-CET paper that you people have given, and everyone is on the same platform, so it's everyone is sailing in the same boat. So don't worry about it. Everyone found the the questions difficult, and everyone was thinking, a very difficult paper. But everyone is sailing in the same boat, guys. Don't worry about it. Okay. So Dr. Libra says standard paper. मतलब standard था, but you're supposed to use your brains. Like it was a very good paper. I found it good, and that's why we always say AIMS is AIMS, And this seemed to be something coming out directly from AIMS, and it was very great. I mean, I liked the paper. Though few questions were off here and there, but it was a good paper, right? So oral axis, laryngeal axis, pharyngeal axis. These are the three things which they must have shown in the image. So one is your oral axis, other is laryngeal, other is pharyngeal, and these three axes normally come in one line. So when the three axes come in one line, what happens is your laryngoscopic view. When you're putting a laryngoscope to view, it becomes easy. So how do you make the sniffing position, guys? You keep a 8 to 10 centimeter pillow below the occiput, and that causes a head extension and a neck flexion. So there's a neck flexion taking place along with the head extension. So these are 5 points which they normally ask. All these are exam points: head extension, neck flexion, right? Oral, laryngeal, pharyngeal axis coming in one line. Position used for intubation. So neurosurgery is not correct. ENT surgery is not correct. Insertion of bougie is not correct. Ideally, it's the position used for intubation, which is called as the sniffing position. That's the correct answer. It was a Dr. Nimra says, Dr. Arish Ali says, sir, big fan of you. Hey, thank you, yaar. Thank you, guys. Oh, I should be reading comments more. Makes my day. So Dr. 𝐒𝐿𝐈 says, sniffing position for intubation, neurosurgery, neck position, insertion of bougie. Acha, so Dr. 𝐒𝐿𝐈 is correct. So neck position for intubation. These are the four options. So guys, if it is neck position, it's not necessarily only a neck position. Why? Some people might say that if this was the option, neck position for intubation, sir, why is this not correct? So because sniffing position is not just the neck position. Sniffing position is also your head extension. So basically it involves head extension plus neck flexion. So therefore it is not just the neck position. So your option C is incorrect. And Dr. 𝐒𝐿𝐈, thank you so much for pointing out, great. I've recollected most of the questions here coming on YouTube here. We should be coming more often. Perfect. Of course, people gave us a recall, but having so many students around and correcting me, I mean, all the 4 questions got corrected here. Right? So Dr. Arish, thank you for your comment. And Dr. Nimra says integrated and application based, correct. Dr. Nimra says bougie क्यों नहीं? अरे bougie भी हो सकता है, मैं मना नहीं कर रहा हूँ. It's not a bougie, but bougie के भी point is that for a bougie also, this is not the position that you want. One option Dr. Abdul Qadir says was ideal position for intubation. अब ये डिसाइड करो, ये स्निफिंग पोजीशन था कि अच्छा, मतलब यू आर सेइंग कि अनदर कोई मे बी नॉट न्यूरो सर्जरी बट इट मे बी आइडियल पोजीशन. यार तो स्निफिंग एंड आइडियल आर द सेम ना डॉक्टर अब्दुल कादिर? नहीं. सो डॉक्टर वन मोर डॉक्टर सेज डॉक्टर 𝐒𝐿𝐈 इज राइट. बूजी नाराज है अभी, सेज डॉक्टर कैलाश. हाँ यार, बूजी कौन यूज करता है? फॉरगेट द बूजी यार, बूजी इज अ टाइम पास थिंग. But in a way, it's right. Yeah, whenever you're inserting the bougie also, I'm not denying. See, when you're trying to approach the trachea for intubation, you're going to use the same way. I'm not denying it, right? But anyways, this is what is called as a sniffing position. This is also called as a McGill position. People also call it as Jackson-Chevalier position. They also call it as a barking position. All these positions mean the same thing. These are called as the position for intubation, right? It's not just a sniffing position. You can also call it the McGill position, right? Dr. Nimra says mark sniffing, sir. So correct. I think most of you have marked sniffing. I agree. Most of you, right? But only point Dr. Prasanjit says neck position for intubation was given. See, whatever be the option, I think everyone knows and everyone must have marked it correctly as a sniffing position for intubation. And that's the correct answer over here, right? Maybe some of the options have changed and they might be changed here and there, but this is the correct point. So we are done with this question as well. Dr. Waqas says, हाँ sir, jaldi next. Chalo next पे आ जाते हैं. This was one where normally when we teach capnography also, guys, we do tell it, but we kind of say very fast, very fast. This is something which was slightly when we discuss, but we don't expect it to come directly in the exam. We discuss this during when we are teaching, but actually speaking, this was the first time when something like this has been asked directly. In the capnography image, they will normally ask you that step ladder pattern, or they might ask you, something like that shark fin appearance. So you know what is that, or spontaneous breathing coming with curare notch. But asking about the phases, according to me, it's not been asked directly anytime, right? But yes, we teach when we are teaching, but we don't tell students, there's so much emphasis on this. That's the point. So the point is, what does the phase 3 represent? So phase 1 is here, phase 2 is here. They had asked you phase 3 and then it becomes phase 0, right? So phase 3, Dr. Shan, I'm coming to that Ambu bag also. Wait. One option was plateau of end tidal volume. Alveolar air expiration. So correct. Agar ek tha alveolar air expiration. So let's change this answer. This becomes alveolar air expiration then. Alveolar air expiration. This is the correct answer. Phase 3 corresponds to your alveolar air expiration. So this becomes the correct answer, right? Dr. Sharat says twisted in H2 and MMHG. I'll come and discuss that point, guys. Ek hi question bacha, I think, after this, and I'm going to discuss that, right? So let me first see what Dr. Mehak has given. Alveolar air expiration and end tidal is the option. Alveolar air. Plateau tha. Are? Dr. Nimra says now plateau tha. Ab kiska baat manna hai? Alveolar plateau, Dr. Nimra says, was there. And then Dr. Mehak says alveolar air expiration and end tidal. No, end tidal will be here. Okay, let me just discuss the capnography part. See, when you're discussing capnography, it means it is discussing, what it is catching is, imagine you take a monitor and keep it in front of someone's mouth and carbon dioxide is coming out. So once the carbon dioxide comes out initially, is it proper carbon dioxide coming out? No. Initially, what you're going to get is the upper part, which is just oxygen, right? So when I'm breathing in, oxygen has gone inside. Now my whole airway is full of oxygen, right? So when I start breathing out, what happens first? The first thing to come out is oxygen. So the monitor does not detect any carbon dioxide coming. Therefore, it is a flat line. This is your phase 1. It's just started, so carbon dioxide coming has just started. That's phase 1. And then slowly, carbon dioxide and oxygen combine and they come. So this becomes your phase 2, right? Which is a combination. Then suddenly, when all the carbon dioxide of the alveoli get released, that is where it goes up and then it becomes straight, something like this. One second. This is the phase 3, right? This is the phase 3. And then after, so this is the complete carbon dioxide, alveolar carbon dioxide, right? And after that, the last then is the inspiration that takes place. So this becomes your inspiration when it is going to take place. So these are the 3 things which you see. So the stage 3 is basically your alveolar plateau phase, where during expiration, all the alveolar carbon dioxide gets detected. In fact, this point which you say, the highest point, this is what is called as the EtCO2. This is the maximum alveolar carbon dioxide detected. The value which is between 30 to 35, almost the same as PCO2. So this is the maximum alveolar carbon dioxide detected. So this point is called as EtCO2, end tidal carbon dioxide. This is what we call as end tidal carbon dioxide. It was the maximum carbon dioxide detected in a patient. So when carbon dioxide is coming out, initially there is no carbon dioxide, then slight increase, then more increase, and the maximum is seen over here, which is end tidal carbon dioxide, and after that inspiration takes place. That's why the graph looks like this. So now angles were marked as C and D. C and D nahi hoga, alpha or beta hoga, guys. I think this angle, I mean C and D, I'm not sure. This is called alpha and beta angle. This is called alpha and beta, right? So alpha angle and beta angle. And asked what is the line CD. हाँ तो C and D ये हो गया ना, इसको जो मार्क करते हैं A, B, C and D. So that is the alveolar phase. Okay, so you are reconstructing the question, Dr. Sanket. Nice. So Dr. Sanket says यहाँ पे C लिखा था, यहाँ पे D लिखा था, and they have asked what is the line CD, which means they have not asked you what is phase 3. Very good. Perfect, guys. So in the capnography, what does the line CD represent? This is what the question was. Am I right, Dr. Sanket? Good, good. Nice. Okay, right. Dr. Sanket says this. So in the capnography image, what does the line CD represent? Okay, so CD becomes this alveolar point. So angles नहीं था, angles ये होगा, guys. Angles ये है. This is the alpha angle and the beta angle. So you're talking about this. This becomes alpha and beta angle. And you're right. Then this point becomes the C. This becomes the D. And this line between the C and D is your third phase, which is called as the alveolar plateau phase. So remember, dead space air ये नहीं है. Inspiratory phase is over here, so it's out. So inspiratory phase is also out. Dead space air is also out. And the combination of alveolar and dead space is your phase 2. So even that is out. Fourth option was mixed gas expiration. Same thing, guys. Oh, Dr. 𝐒𝐿𝐼 says fourth option is mixed gas. Correct. So this is out then. Instead of expiration of alveolar and dead space air, the fourth option becomes mixed gas expiration. Okay. Perfect. Mixed gas expiration. Correct. हो गया. So anesthesia के सब questions यहाँ पे YouTube पे ही हो गए हमारे. All the questions are decided. Okay. Dr. Leena says, guessed it right. Good. Guessing works sometimes. Right from your childhood till now, we guess sometimes, and sometimes guessing does work, but not always. Only on few questions. Right. So hopefully this question also done. Should we go to the next one then? Anyone else? Any changes you want me to do then? Dr. Yogesh has said end tidal plateau, one option, and other option was carbon dioxide expiration. I don't know exactly उसमें end tidal का option क्या आएगा. Dr. Nimra says plateau देख के plateau mark कर दिया था. हाँ exams में ऐसे ही करना होता है. You have to use your brains. That's what I said. Sometimes it's okay. So this is one question which did come. We teach, but we normally don't pay so much attention because we normally, we just tell and we go away. We touch the topic and we run away because we normally say, the graph which have been asked is like this, this graph, or we see the step ladder pattern. We normally talk about that. But about regarding the individual angles, the images, this point is where we don't pay so much emphasis on. Dr. SJ says plateau and tidal were in the same option. So plateau with end tidal volume, plateau with, okay. So they are saying CD क्या है? Alveolar plateau phase with, चलो यहीं पे reconstruct भी करते तुम्हारा मन है तो चलो. Alveolar plateau phase, ETCO2 plateau phase was given, says Dr. GI. Plateau and end tidal were in the same option. So plateau phase and end tidal. You're saying something like this. Guys, remember it is just the plateau phase here. बाकी जो भी पूछा exam में वो पता नहीं. I don't know about the other two options. Maybe then these two options we are not reconstructing correctly. These two options, the dead space and the inspiratory phase. Maybe these two we are not reconstructing correctly. But alveolar phase is the correct answer. That phase 3, that line CD represents the alveolar phase. And even if someone says end tidal, remember the point D then becomes end tidal, na? So even end tidal will be correct. The point D is end tidal then. Dr. Harsh says, आगे बढ़ो sir, plateau बहुत हो गया. हाँ, बहुत हो गया plateau. Let's go to the hills. थक गए plateau में. Let's go to the hills. This is the last question here. And this was, according to me, a confusing question. Because they have said pressure relieving of a pressure release valve or a pop-off valve, which is said. So pop-off valve तुम्हारा ये होता है. This is your pop-off valve over here. And this is to prevent the over pressurization of the lungs. When you're using an ambu bag, you have this pop-up valve to prevent the over distension, maybe, over pressurization of the lung. You don't want to, cause so much pressure. It prevents the over pressurization of the lung. Right? Over pressurization of the lung. Now, the point is, some people said there were 3 options mentioned with millimeter of mercury. So if 3 options were given with millimeter of mercury, then centimeter of water is the correct answer. But next, some people said, no sir, there were 2 options of centimeter with water and 2 options with millimeter of mercury. Because not everyone will recollect correctly. And how can everyone? I understand that. So 2 options with millimeter of mercury is out. Your options are between centimeter of water. Let's start from there. Dr. Nimra says, no sir, दो थे. हाँ, correct. तभी तो मैं बोल रहा हूँ ना, 2 थे centimeter of water. They were 2 centimeter now. Now the point is, if they have given 30 to 40 and 10 to 20, I want to ask you whether they have mentioned pediatric and adult, because now that changes the answers a little bit. If they have mentioned pediatric, remember in a pediatric ambu bag, you don't want the pressure to exceed more than 20 centimeter of water, right? And the relieving pressure in an adult guy is actually not 40. If you will go through the books and the manual which is there, it normally recommends that it says that it is around 60 centimeter of water, right? Dr. SJ says pediatric. Oh, अच्छा अगर pediatric दिया है तो correct answer 10 to 20 है. That's the point. Dr. Lokesh says no sir. How do I realize now? Okay, so let me tell you both the things. According to me, see, it's not that I know it perfectly. I'm just sharing my knowledge with you. No teacher or someone can say that I know the answers or the options correctly or perfectly. I just know what I know. I've been practicing anesthesia for more than 20 years now, right? So I know from whatever I have studied. I'm sharing my knowledge for you. Things keep on changing. I may be wrong many a times, right? So I accept it. I may be wrong. But from what I know, my knowledge, that says that pediatrics patient, if you're using an ambu bag in a pediatric patient, you don't want to use so much pressure so as to damage the lung. The presence of a pop-up valve is given as a safety mechanism. This is a kind of a safety mechanism which has been given, that in case you're over pressurizing it, the lung shouldn't get damaged for the baby, and that pressure should not exceed 20 centimeter of water in case of a pediatric patient, according to me. However, in adult, up to 60 centimeter of water is what they say is the relieving pressure. So therefore, if they had mentioned pediatric, I will stick with 10 to 20. If they have mentioned adult, I will go with 30 to 40. Or if centimeter of water is not, if millimeter of mercury were there, then we know the answer was centimeter of water. So Dr. Susanna says that's not mentioned. Dr. Arvind says ambu bag size look like a pediatric one. Dr. Sahil Sharma says I think option is 10 to 30 centimeter of water. So Dr. Sahil, I mean, I just want to know what are the other 2 options which were given. So if this was given maybe 30 to 60, I mean, if it's an adult one, I'll go with this. Okay, so Dr. Sanket says pediatric was not mentioned. So if pediatric is out, only image was given. So this is our image given. And the pressure for the pop-up valve was asked. So if only the image is given, they have not mentioned pediatric, then I will stick with the option 30 to 40 because that is the closest to 60. Do you remember in INICET they asked you once question that at 3 liters, how with nasal prongs, how much FiO2 do you get? This was last year's INICET, and the whole world was like, with 3 liters you'll be getting 3 liters of oxygen. How much FiO2 is going to the patient, right? So you remember the formula was that 20 plus 4 into the flow rate, right? So 20 plus 4 into 3, this becomes 32%. Options given were 25, 30, 35 and 45. So lot of the people, they said that sir agar 3 liters diya hua hai, so the correct answer they have marked as 35. I did not agree with everyone, because 4 liters is what corresponds to 36 and 36 is close to 35. So if the students had marked 35 there in that exam INICET, 35 is closer to 36 and 36 means 4 liters. So 3 liters does not correspond to 35. 3 liters would correspond to 32 and the closest is 30. So you will find my YouTube video also based on that, where I've differed from my colleagues in saying that it according to me it is not 35%, it is 32%, 30%. So Dr. Omkar says if it is difficult for pediatric and adult by just pick, how can we decide? Dr. Omkar says, you are right, but see, I said this is my knowledge. This is my knowledge. This is what knowledge I have. I'm not saying if there's anything else or not, that this is my knowledge that, in a pediatric patient, so maybe the pediatric people will clear it further, that what is the relieving pressure. Ideally, the relieving pressure for an adult ambu bag is around 60 centimeter of water. Okay, according to me. So 30 to 40 or 60, according to me, should be the correct point for an adult. So I will normally stick around with this option. Had there been pediatric, then I would have got confused, maybe that is 10 to 20, right? As I said, that is one controversial thing which I found, and I told you, right? The last 2 questions which according to me were difficult. Before that, everything else was easy. Till here, the first 4 questions from anesthesia was easy. The 5th one was not a controversial question. It's just that we don't pay so much attention to it. But the 6th question from anesthesia was controversial. According to me, not very sure, depending on what has been asked or what are the options given in the exam. It depends on that as well. Right? So Dr. 𝐒𝐿𝐿. See, don't have to go by in a picture, you can't say whether it is a pediatric or adult written. I'm sure you're right. Pediatric and adult, you can't find it, I mean, normally from a picture. And that is why in that case, you will normally stick around with adult guys. Okay, from a picture, you can't decide based on this, na? Just based on this size, unless until something has been mentioned over here. If they mention the size, then it is okay. But just based on the picture, I think it is difficult to decide. So Dr. Lokesh says 10 to 20 millimeter, 10 to 20 centimeter, 30 to 40 millimeter, and 30 to 40 centimeter, right? Dr. Arvind says it's a neonatal ambu bag for sure. Neonatal आएगा तो of course that's what I'm saying. So ideally, see, anything with centimeter of water should be the correct answer. Centimeter of water, right? The point is that if it's a pediatric, I will stick around with around 10 to 20. If it is an adult, I will go with 30 to 40, right? Next, just depends on what image they have put up and who has set up the paper and what options they have actually put in, which we don't come to know, right? So this was the discussion that was there from anesthesia. Any other points, guys, do let me know, and hopefully you will get through. Remember, everyone is sailing in the same boat. Everyone is sailing in the same boat. The paper was same for everyone. Some people, even the morning and evening sessions both are. So don't worry about it. Dr. Anzil says pediatric for sure. Pediatric agar hoga to 10 to 20 I will mark. Okay, but I still don't know what the examiner has set up correctly or what options they have given correctly, right? So let's cross our fingers and hope that it is the answer, right? Dr. Harish says Jal hi Jeevan hai is question me too. Chalo guys, thank you so much, okay, for joining me at this session. And I'm so happy that, most of the questions got reconstructed over here in the sense that we could find the stem, we could find the options, and I felt so good about it, getting connected to all of you. Dr. 𝐒𝐿𝐿 says, sir, what is your option? First shift, your second tough tha. Good question. देखो, tough तो दोनों था, ऐसा नहीं है. But it depends on what subject you were concentrating. If you ask me, few subjects were easy in paper 1, few were easy in paper 2, and the same way around, but it was not the same actually. But if you will find that, yeah, students did say that paper 2 was slightly more difficult. When you asked them, they said paper 2 was much more difficult. Okay, when you spoke to the students, right, they said that. I mean, I will say that questions were general, I'm not denying that, and they were difficult both in 1 and 2. But when you spoke to the students, a lot of them felt that, according to them, 1 was slightly easy and 2 was difficult. But I feel, what, it's not a question about one question that has taken place. Now, the paper is going to be there for both the things. And if someone has set it up, so if they have given one easy, something else will be difficult. That's the point. A balance is always maintained. So, it's going to be the same for everyone. Dr. Nimra says, lengthy tha second shift mein, that was putting pressure. I agree. There were a lot of clinical questions asked, guys. And that's what I'm telling you is the way forward, that, you guys have to have concepts clear. When we take classes, guys, that's what we always tell you. Don't go for shortcut methods initially. The rapid revision, a lot of people feel, sir, even we have our rapid revision, guys. But rapid revision has to be done only when your concepts are clear. I mean, this is all of you should be getting your seats. This is a saying for the people who are preparing for the next exams, the coming ones. Your concepts are clear, then go for rapid revision. A lot of people, what they want to do is straight away go for rapid revision, then solve. And with a paper like this, if your concepts are not clear, guys, remember, even the rapid revision is not gonna help. Trust me for that. Trust me for that. Your rapid revision works only if your concepts are clear. If your concepts are not clear, for example, let me give you anesthesia example. Na? Take this example of capnography. If everyone has been studying capnography like this, one graph goes like this, one graph goes like this, one graph goes like this, right? Another graph is, absolutely flat line. In this case, if you have not studied the basic part or the concept of what is happening, this question can never be right. If you have just seen a rapid revision video where we have just said, this is a normal graph, this is obstruction, right? This is increase in carbon dioxide, this is no carbon dioxide. So in that case, this question cannot be solved. This can be solved only when your concept is clear, guys. Right. So guys, thank you so much for joining. I think other people are also waiting. We've got other, recalls also coming up. So that was from me and from my side. Thank you so much for joining. Right. Any other questions or doubts, please ask me. You all have my Telegram ID. My Telegram ID is Dr. Vinish. You can get connected to us. That's my Telegram ID. ठीक है? और कोई questions और कोई doubts, please ask me. And all the best. Do well. Everyone is sailing in the same boat. Remember that. No one is on a different boat. Okay? So take care. All the best. Do well. Thank you, everyone. Thank you. Thank you, guys. Thank you so much, all of you. Thank you. Thank you. Thank you, guys, for this session. For joining me at this session. I loved it. Thank you so much. Okay. Bye-bye and all the best.